So hey guys, my name is Rishabh Singh, a first year medical student from Eastern Medical College and Hospital, Comella. Welcome to my channel. If you are new here, so please go and subscribe to my YouTube channel. I try to provide you some educational video related to MBBS. I hope you will gain or acquire something new at the end of it. If you like, don't forget to subscribe, like and comment below. Hey guys, welcome to my YouTube channel. Today's topic is anterior abdominal wall and umbilicus. So starting with the anterior abdominal wall. Coming to the layers of anterior abdominal wall is firm and elastic and has 8 layers. Skin, superficial fascia which contain fatty layer called Camper fascia, membranous layer called Scarpa fascia. External oblique muscle, internal oblique muscle, transverse abdominis, fascia transveralis, extraperitoneal tissue, parietal layer of peritoneum. Deep fascia is absent in anterior abdominal wall because to allow bulging of abdominal wall after the meal or in the pregnancy. If the deep fascia will be present, then in case of pregnancy or after eating meal, our tummy will not bulge. So deep fascia is also absent in penis, scrotum and perineum. Deep fascia is also absent in penis, scrotum and perineum along with the anterior abdominal wall. Now coming to the topic skin. As you can see, skin have various type of lines which are visible like midline groove, linea semilunaris, transverse grooves, line of venous, line of gravitarum which is white lines of the pregnancy, Langer's line which is cleavage line that is present horizontally. So there are many type of lines which present in the skin. As you can see the diagram, soft tissue landmark on the front of abdomen, the tip of ninth costal cartilage, costal margin, umbilicus, midline groove, linea semilunaris is this line, then linea transveralis is this line, then linea gravidarum which is white lines of pregnancy, inguinal line, Holden's line, line of Venus, pubic tubercle, pubic symphysis, anterior superior iliac spine. So these are the lines of the abdomen. Coming to Langer line, therefore abdominal incision preferably should be given horizontally so that wound heal with no scar. So whenever the cosmetic surgery is performed, then the incision is given horizontally, because if the incision is given horizontally, then the wound will heal and it will cause no scarring. Scar will not occur in the skin. So that's why this is the method by which the cosmetic surgery is done. Now coming to umbilicus. It is the most obvious feature of anterior abdominal wall. It is normal Perkin scar representing the site of attachment of the umbilical cord in the fetus. Position. In adult, it is between lumbar 3 to lumbar 4 vertebra. In newborn, it is lower level than adult. In old age, it is much lower than lower level. Now coming to anatomical significance of umbilicus. So the venous blood and the lymph flow upward above umbilicus and downward below its level. It indicates the level of T10 dermatome. It is one of the important site of portocaval anastomosis. Now what is portocaval anastomosis? Portocaval anastomosis is the anastomosis of the tributaries of the portal vein and the tributaries of the sympathetic vein. This is called the portocaval anastomosis. It is found in various regions of the human body. Coming to embryological significance, it is the meeting point of 4 folds by embryonic plate. In embryonic life, a defect exists in linea alba at this site, and that defect is called umbilical ring. Now 4 important embryological remnants at umbilicus. Ligamentum teres, which is the remnant of left umbilical vein. 2 medial umbilical ligaments, which is the remnant of umbilical artery, and median umbilical ligament, which is remnant of arachis. As in the diagram, you can see 4 embryological remnant at umbilicus. like you can see here urinary bladder, through which median umbilical ligament is attached, and you can see umbilicus here, and you can also see the medial umbilical ligament, which is the remnant of umbilical artery, and median umbilical ligament, which is the remnant of arachis, and ligamentum teres, it is the remnant of left umbilical vein. So this diagram clear all the 4 embryological remnants present at umbilicus. Now coming to clinical related portion to the umbilicus. 2 congenital anomalies related to umbilicus are fistula. Fecal fistula, which is the failure of vitellointestinal duct to obliterate, the results in at umbilicus. Urinary fistula, failure of arachis to obliterate, the lead to urinary fistula at the umbilicus. Exomphalos or omphaphalocele, it is the failure of midgut loop to return in the abdominal cavity cause exomphalos. Intestine protrude in all layer of abdominal wall at umbilical ring, a thin transparent membrane amnion cover it. So this is exomphalos. Now coming to congenital umbilical hernia. It is the condition intestine protrude through the umbilicus due to weakness of umbilical scar, so covered by the skin. So this is the congenital umbilical hernia. Now after umbilicus, coming to superficial fascia. Contain variable amount of fat. Below this line consists 2 layers, which is Camper fascia and Scarpa fascia. Camper's fascia or superficial fatty layer. The superficial fatty layer of superficial fascia of the abdomen is unknown with the superficial fascia of the adjoining area of the body. Over the penis, it is devoid of fat, and in scrotum it is replaced by the involuntary dartos muscle. Coming to Scarpa fascia, deep membranous layer of superficial fascia of the abdomen is made up of elastic type of fibrous tissue. Some features are: in midline it is attached to linea alba. On each side it is separated from underlying external oblique muscle by the layer of loose areolar layer. Below it is attached to fascia lata, and it is prolonged over the penis to enclose it up to the base of glands and form a buck fascia, which is called fascia of penis. Third point, it covers the scrotum when it is replaced by dartos muscle, and then continues with the superficial fascia of perineum, the Colles fascia. So this completes our today's video. In part 2 of anterior abdominal wall, I will discuss about the nerves, arteries supplied to anterior abdominal wall, about rectus sheath, and also about the 9 region of the abdomen. So I hope you like this video. If you like this video, then don't forget to subscribe to my YouTube channel, which is MBBS Studies with Rishabh Singh. Thank you.